Welcome to Marketing in the Age of AI, the show for leaders who want real results, not more noise. Join Emmanuel Rose as he helps business builders turn AI from a confusing add-on into a practical advantage with clearer messaging, stronger trust, and smarter systems. If you felt the shift happening in real time, you're not imagining it. In the agentic pivot, Emmanuel calls it the move from experimenting with AI to building with it, so it supports your team, your brand, and your growth. Let's get into it.
Welcome to this episode of Marketing in the Age of AI. I am excited to speak with Mariano Garcia-Valino, who has worked at the intersection of healthcare, technology, and investing for over 25 years. He has built and sold 3 healthcare businesses, producing exits in excess of $10 billion. He has a talent for spotting opportunities that others don't. Today, as founder and CEO of Xenia, which I hope he'll correct me on how to say that too, recognized by Newsweek as one of the world's best digital health companies, is bringing his unique perspective to reimagining what's possible when human-centered care meets cutting-edge technology. His work addresses healthcare's core challenge, bridging the gap between advanced medical science and patients' daily lives. Mariano, thank you so much for taking some time to chat with me today.
Hi, Emmanuel. Thank you so much for having me.
Oh, it's all my pleasure. It's been an amazing time, hasn't it? This AI bubble that we're in.
Yeah, I'm not sure it's a bubble though, but I'm not a finance guy, so I wouldn't discuss valuations and prices. But in terms of the future that we're building, I think I think it's completely revolutionary. I don't think we have seen things like that, at least not in our lifetimes. Maybe the beginning of the internet, maybe that, but that's the only thing that I can feel is comparable.
Yeah, I agree with you, and I do find the leverage that we've been able to embed into projects now with the AI tools is phenomenal, and gives us, to me, and I think you might think this too, the opportunity for a second renaissance, because the machines will actually be doing a lot of the work that they
It
need to
is,
do,
yeah.
so we have time to do what we should be doing.
I hope so. I mean, I think it's there are people that are more knowledgeable than I am. They have all sorts of scenarios here, so it's difficult to say. But I tend to be optimistic. I am seeing things where we're getting more efficiency and better lives for people in real time with AI today. I think we're seeing that every day. So far, I think that things have been extremely good. Now, things that are we going to lose a lot of jobs about that? I'm not sure about that. I mean, people differ on those things.
Yeah, I think we've seen where technology, as long as you can trace it back, has eliminated some jobs and brought on new
Mhm.
jobs, right? So, I mean, the guys that made wagon wheels and the guys that went whaling for whale oil, those guys lost their jobs.
Yeah,
But there was new jobs that were created.
yeah, not at this speed though. So it's probably
That's
gonna
true.
take a little
That's a
bit
good
of
point.
time to adapt. But in any case, I think that there's a lot of value that will be passed on to society, and I think interestingly also, I mean, for the all the revolutionary products that we've seen in the past 2 decades, this
Yep.
one is likely the one that will probably not be not result in huge companies that take all the value. I think that funny is that we have at the same time 5, 6, maybe 7 different models, which I'm not going to say that interchangeable because I don't think they are, but they're
Right.
very replaceable one for the other. So it looks like most of the value will be captured by society, really.
Yeah, I do think that's interesting. Sometimes people use that word democratization, right? Where it's
Mm,
like it's down to a very small level where if you have an idea for an app that could change the way your family goes shopping or goes to a restaurant, or if you have an idea for how to change healthcare, you could build out a prototype very quickly
Yeah,
and get a team that's dispersed all over the world and build something out in 15 days, 30 days, 90 days.
yeah,
It's something that would usually take years to develop.
yeah, yeah. No, I mean, 5 years ago, it took us years to develop things that we are doing in days today. Absolutely.
Yeah. So, well, talk to me a little bit about what. And I know I butchered the name Xenia. How do you say that?
Yeah, no, that's correct. Exactly,
Okay.
Xenia.
Okay. Good.
Yeah.
Yeah. What are you guys
So,
doing? Talk to me about that.
so the logic originally was quite simple. We think it took us a while to actually find the right product for it, but our logic was, healthcare was built uh, in its present form around 1940 and 1950, and at that time it was designed to solve the biggest problem in healthcare, which were infectious diseases. And
Okay.
around 50% of people died of an infectious disease by that time. And so there are many portions of the system that were designed that way, and they have been tremendously effective to actually eradicate infectious. We have not eradicated infectious diseases, but hardly anyone dies of an infectious disease today. So we have
Right.
reduced the mortality close to zero from infectious diseases, and people have been living 20, 30 years more in this
For sure.
period of time.
Yep.
So obviously, a big success for the whole system. Now, success brings longer lives. Longer lives brings more difficult diseases to deal with. And
Yes.
reality is today about 85% of the money we spend in healthcare goes towards some chronic disease. And chronic diseases are very different from infectious diseases. When infectious diseases, one obvious thing is, for example, your doctor can wait for you because you will have a symptom that will drive you to that, right? So
Yeah.
you will have some pain, temperature, something that will drive you to the doctor. If you do the same thing with uh, blood pressure, it may take decades to take you to the doctor
Right. To
because you
show up. Right.
have zero symptoms that will take you there. So
Yep.
one thing that doesn't work is waiting for the patient to actually go to the doctor. The other thing that doesn't work as well is it used to be that treatments were temporary and simple. So
Yep.
you have whatever a sore throat, and your doctor may give you some painkillers, maybe an antibiotic, take you home in 7 days. You're done. You have diabetes, it's a very different story. You have to learn how diabetes works. You have to understand how your body feels. You have to understand how to count carbohydrates. You have to understand how to calculate your dosage of insulin. You have to train yourself that once you have applied your insulin, you cannot overeat or undereat because you will have trouble stabilizing, and most of the times you make mistakes and you don't even notice because, as I said before, there's no clear symptoms.
Right.
So the amount of knowledge that a doctor need to transfer to you in order to take care of your disease used to be a certain amount, and now it's maybe 10x that amount.
Right.
And and people make mistakes, and actually, if you actually go and check on how much money we are spending in people making mistakes, it's about 50 or 60% of the total expense. And so you put that all together, and you end up in the last 20 years we have been growing our healthcare expense somewhere around 2.5 times inflation, and we are coming to a point where we cannot pay for it.
Right.
We are seeing plans everywhere cutting support, not covering certain medication, pushing some expense to the patients, and all those are band-aids. They're not gonna cure the issue. And but so what we thought is, we now have AI, we now have more data. If we actually put AI and data in the service of reducing fragmentation and reducing the intermittence of, I go to the doctor, I learn a few things, and I go home and I don't know anything about it for 6 months, and then I learn a little bit thing again. So if you reduce that intermittence as well, you may be able to reduce cost, and you may be able to increase clinical health in general. And so we started with a prototype that basically did that, just took a little bit of data from patients, from wearables and sources like that, and just took it up to the cloud, put a couple of crawlers understanding that, and
Yep.
simply just raising flags whenever we think that this patient may use some help. And the first prototype was incredible, and that this probably took us a year and $1 million. It was 5 years ago. Today would
Yep.
take us almost nothing, and
Probably
maybe
take you
20,
90 days now. Yeah.
probably 90 days. Yeah. But in any case, at that time, when we started using it, we immediately saw, we're dropping the amount of cardiac arrest by about 15%. We are dropping the amount of uh, brain aneurysms and things like that by something around
Yep.
15 to 30%. And we are dropping the chance of people dying for about 20%, and we're dropping cost for around 15 and 20%. And
Nice.
so we were static. We published that in Diabetes Technology. We thought, we have the greatest product ever made and things like that. We realized that it was very difficult to sell. So what we found out is, patients are very difficult to reach. There are too many, too fragmented. Doctors as well. It's very difficult to get the health plans to pay for it because they don't cover your health for a long period of time. So
Right.
they understand that if you, for example, if you lose weight today, someday you're gonna save money in heart failure. But that someday may be outside of their scope for. So we realized that this is a very difficult uh, place to find the spot where you can add you can have the people that decide, which are normally doctors, the people that pay for it, which are normally companies that actually pay the health plan for their employees, and the people that actually benefit, which are the patients. And it's very difficult to find a place where they all meet. What we found, at least in Brazil, and this would work also in the US, it wouldn't work in every country in the world, but what we found is that the right place to be is actually with the person that pays, with the companies that actually buy health plans
Hmm.
for
Uh-huh.
their people. So if you manage to deploy digital tools within that population, then you get two things at the same time. You get the patients feeling better, and you get the employers saving money. And that's what we did. We're starting selling these products to companies together with health plans,
Nice.
and that's how we built the company.
I love it. And about how many clients do you have using it right now?
We have close to 150,000 people using it,
Wow.
and that counts for about something like 250 companies.
That's a good test group, isn't it?
It's a nice test group, but it's
Yeah.
small. I
Yeah.
think this is at least in Brazil there are something close to 50 million people that could benefit from this,
Okay.
and
Yeah.
so there's still a long way to go, and it's much higher in the U.S. because the U.S. is twice as bigger than Brazilian population, but the penetration of private plans is twice as much as well. So you have
Sure.
four times the people.
Now, in your work on this, have you found any particular wearables that are better or more likely to provide good data?
We try to work with everything. I think the more a wearable is designed for a medical use. So let's say you get Abbott Freestyle Libre, which you
Mhm.
have in the US, is a continuous glucose monitor. Those things are more designed to interact, and they have better APIs which you can connect with.
Yep.
But Samsung also works. Google Fit works. Apple Health also works, and those things are becoming platforms where you can actually connect everything else. So
Sure.
we started by trying to connect to everything, and then over time we realized that it's much easier to connect with those intermediate platforms, which of course they like as well because they want to be able to capture the data.
Sure. Yeah. And at some point, the data will be as valuable as anything, won't it?
I think the data and the algorithms are the value in this market. I think the better algorithms you have, the better your
Yeah.
results will be, and the more data you have, the better your algorithms will be. So it's a little bit of strength on terms of amount of lives and quality of the way you analyze them.
And if somebody has one of these wearables, is there a way that they can kind of cobble this together for themselves to then bring
Yeah,
information to their doctor? How would you recommend that?
yeah. I think that, well, in the US, you can connect your wearables, most of them, to your EHRs. Apple allows you to do that. Many wearables, and I know the Whoop. I'm using Whoop now, but
Yeah,
Whoop would allows you to print your data and just send it to your doctor if you want to do that. And frankly, you can always get your data and just have your LLM analyze it as well. I do that all the time.
and
This, this
which LLM?
you
Which
shouldn't replace your doctor for that, right? But
no, no, absolutely not.
we have all done it.
Or we just want hints. We don't want that to do the diagnosis,
Yeah.
right? But do you which LLM do you prefer for health related questions?
We prefer Claude, but
Yeah,
frankly, we've used GPT, we've used Gemini. I don't think there is anyone that is particularly better. Claude is better for coding, so we prefer Claude just because of that. But it's better for coding, and therefore we use it for the rest of the company because you want to keep one single context that
sure.
knows what you're doing. When you speak to a client or when you're coding, the model should be the same.
Right. Yeah,
So
makes
we,
sense.
we, we believe that Claude is kind of part of our team in that sense.
Yeah, Claude is an amazing tool for anything coding related. There's no
Yeah.
question. Well, let me change gears a little bit and ask you about how, if in any way, the AI tools have impacted the art that you're producing at this point in your art career.
Yes, it has. Yeah, yeah. I have been using AI tools for the best part of 3 years now with photography. I think that you're referring to that.
Yeah.
Yeah, I haven't been using them from prompts. So I have been using them to modify photographs that I take with traditional methods. But as I saying that, even the cameras are full of AI anyway. So they also actually work in the capturing as well. So yeah, I'm not afraid of using AI. I think that's there is divisions here on how much AI you can use before it doesn't become a work of art anymore. I don't really think about that. I just do whatever I need to actually get to the final solution. And frankly, if you tell me how much I use it in total, I don't even know, because sometimes I come back and I do different things. But mostly I don't work from prompts. But I'm not saying that you shouldn't. It's just
Right.
my take.
Are you using it inside of one of the photo analyzing tools, or how do you are you uploading it into Claude or something like
Well,
that?
I'm using it as a tool as well. So things like, increasing the number of pixels because I want to do some crop that wouldn't be possible without it, or
Yep.
some process that wouldn't be possible without it. And I using it as a creative tool as well. So let's say that, I have a certain frame, and I actually believe that, if we can duplicate this, it would look better. So I use AI to do that as well.
I love it. Uh, I think we're similar in that we like to see push the limits of how much we can use these tools to get outcomes. Have you? What's the spot where you will not use AI in either your professional or your artistic endeavors? You have some hard lines on that?
Uh, Yeah, I think we all have hard lines on that, right? So you wouldn't use AI for the obvious things. I'm totally against using AI for pornography or child whatever, or things like
Oh
that. I
yeah,
mean,
yeah, of course, yeah,
the obvious stuff. But other than that, I mean, other than things that are clearly immoral or illegal,
yeah,
I don't have much of a limit. I don't. I mean, when you talk about things like, is this art if I use AI, or is this my work if I do AI? I don't care much about that.
yeah. No, I think for me, like one of the things I'm not willing to do is to have the doppelganger, the video doppelganger of myself, go and participate in meetings, for instance, even though
Ah,
that technology exists and could very well be better than I am, even in a meeting,
yeah.
right?
I actually I don't get to the point of a doppelganger, but I do participate in meetings with an agent. Just because
Uh,
I cannot go to the meeting, and I ask for the report afterwards, and
yeah,
it's easier to interact, ask questions. So those things I actually do it.
I love it. Yeah. Um, Really fascinating. And I appreciate your time. And you and I could have this discussion for the next 4 hours. I have no question.
Totally.
um, and I do have, I do want to come and visit you so I can go upland bird hunting. So I'm gonna let you know when I make it
Yeah.
down to Uruguay.
That's fantastic. Yeah, I know I'm not a hunter, but I know that
Yeah,
it's a very good place. Yeah.
yeah. It's one of the world's best locations for upland birds. Yes.
So great. So give me a call whenever
Okay.
you come around.
If Mariano, if somebody wanted to get in touch with you and have a conversation about healthcare or about AI, how would they do that?
It's fairly easy to get me in my email. It's m@axenia.com. It's on my LinkedIn page as well, so they will able to get me there.
All right. Well, I hope I can reach out to you again in 5 or 6 months, and we can have a second conversation because I sure appreciate your
Perfect.
ideas around this. Okay. Thank you
Perfect. I
so
would love
much.
that. Thank you so
All right.
much.
Thank you, and we'll talk soon.
Bye bye.
Bye. I think it's a great reminder that the AI can support us in lots of ways, including sending an agent to a meeting we can't get to, or helping in our creative endeavors. And it's good for all of us to push the limits and find how we can be supported, uh, not just in coding or in reviewing documents, but also in the creative endeavors. And really appreciated Mariano's take on that. So I hope you found value in the conversation I had. And if you're in the healthcare space, recommend that you get in touch with Mariano and have a conversation with him about how AI may be able to support the activities that you're in. I also hope that you take more time to find some tools that can help you get some time back in your day. And with that time, you continue to upskill, that you spend it with your friends and family, and that you get outside away from the screens back into nature. This is Emmanuel Rose, Marketing in the Age of AI.
Thanks for listening to Marketing in the Age of AI. Be sure to subscribe wherever you heard this podcast so you never miss a future episode. Your copy of Authentic Marketing in the Age of AI is available at Amazon.com or EmmanuelRose.com. You can also connect with Emmanuel on LinkedIn. Thanks again for listening, and we'll see you next time.